Well, thank you for having me on. Some of you know I had knee replacement surgery, and people asked me why did you just use the X39 and the Ice Wave? I was pretty crazy mogul skier and jumps and stuff like that, and I broke my right leg back in 1973, before some of you were born.
Okay.
Doing crazy things, and it was a boot top fracture, tore my meniscus. My leg was so bad they didn't even pay attention to my meniscus, so that knee was doomed. And so I had that one replaced last August. But one thing that I know as a healthcare practitioner, and this will be important for everybody in this call to know, there are a couple of things that you need to pay close attention to, and it's not just about the pain. If you start getting atrophy of your thigh muscles or your glute muscles because the angle at your knee changes, and because there's so much pain and you cannot contract that muscle, you are on your way to a nursing home, because your partner cannot lift you on and off the toilet when you get older, and not so keen on changing an adult's diaper.
No.
So the number one thing that sends people into nursing care, as far as the family is concerned, is that they can't do that, and it's impossible. But I noticed that because of the angle was changing on my left leg, I couldn't contract part of my quad. And so, you know what, I'm going to have this thing replaced too. The first few weeks are hell, but I thought, after my last one, I was running up hills last March, right after I found out about LifeWave. And then, so the thing is, I had my knee replaced about 5 weeks ago. I put an X39 and an Aeon on it as soon as I could when I was awake, when I was back in my room. I put those on. The nurses were really curious. What is that? What is that? And they come in with all these drugs, and I say, oh, what's that? No, not going to do that. No, don't need that. Okay. Finally, they got used to knowing that I'm not going to take all those things.
Correct.
I'm just going to use my patches. So I have can I share? You got me set up to share, Peter?
Yes.
Okay. I have some pictures, and this one was as soon as I could, as soon as I got the wrap off, which was about a week. You can still see the lines. This is where they anchored the robotic part. It was robotic assisted. There's a hole right there, and then they sliced that open and then drilled into my tibia, and so this thing could watch it. But it was pretty remarkable, really. So you can see, it looks pretty bad. I don't know if that's the right screen, because I can't. Oh, there we go. There we go. There's another one. Give you a good idea what it's looking like, and then you're going to start to see it just kind of. You can see where it's all dimpled up right there. Dimple.
Yeah, so it's raised, but I know that
you can see right here
recently,
where it's already started to fade.
Yeah.
And there's a close up. You can see it's all kind of puckered up and everything.
Mm-hmm.
And then then it starts to fade. And I kept an X39 on either side and then an Aeon right above it.
Gotcha.
And then this was taken yesterday morning.
Look how flat it is.
And it
wow.
Almost within just a few days, it went from, you could really see where it was dimpled up, and it was like it was melting. It was really, really, truly strange how that happened. But obviously, I'm really pleased with it. I have about 85 to 89 degrees flexion already. I mean, the angle between my tibia and my femur. So that's been pretty remarkable. Pain, ice wave. Maybe sometimes it'll still get a little stiff at night. I'll just get up and put an ice wave on it and go back to sleep. The ice wave for me didn't quite do it for where they sawed off the bottom of my femur and the top of my tibia.
Right.
That's pretty severe stuff, but it took the edge of it off so that I didn't have to take as many pain pills. Okay, so you talked about, go ahead, sorry.
Dr. Herman, comparing the first knee surgery healing time to this one.
Oh, the swelling was maybe a third.
A third.
From the one I had before. Yeah,
Okay,
it was much less. I could barely get my pants on the other one because it would fill it up around the knee.
Okay, so before we run out of time, I wanted you to also mention the heart challenge that came up.
I'll go through that really quickly. The other thing that wore out my knees is I've been a runner, and I used to run 40 to 50 miles a week, even after I broke my leg, after it healed up. And really good endurance, but then when I was at rest, I would have these PVCs, the preventricular contractions. And they were random, they would come and go. And I'd been using the X39 for about 4 months, and it was about the same time my hair started changing color. Oh, by the way, before we go, I wanted to, I got to stop this share. I want to show you, I have some other, just really quick, it's only 2 pictures. So this was me in February, before I started using the X39. I'm using the laser on my brain right there. And then this was me a couple of mornings ago. Without any, it's not wet, there's no product on it, it's just dry, it's just turning brown. Okay, enough of that.
Amazing.
Back to the heart. I started putting an X39 right over my heart, and it was one of the weirdest things I've had happen to me, because the PVCs came back, but it was every 5th beat all day long. It was like 1, 2, 3, 4, stop, 2 seconds. 1, 2, 3, 4, stop, 2 seconds. It was waking me up at night. I was gasping for air in the middle of the night. I was diagnosed with sleep apnea. And I mean, it was kind of miserable, because I would feel like I didn't have enough oxygen. And I had a surgery coming up. So I thought, I should go to the cardiologist. He says, well, we're going to do a stress echocardiogram. So they do this. Now, I previously had taken some supplements to help the PVCs. It didn't help very much. I started taking them again, but I was using the X39 at the same time. Went to the cardiologist, did a stress echo, and he comes into the room and he says, your heart was remarkable. It really responded well to stress. We tell people if they can go 10 minutes, elevating every 2 minutes and increasing the speed, you have 0 chance of ever having a heart attack. You went 13 minutes. So your heart's in good shape. You just have these PVCs and this right bundle branch block. And I said, well, what causes that? And if you've been to any of my trainings, we talk about apoptosis. That is programmed cellular death, when your body's trying to kill stuff off to make room for the new. It says we get these apoptotic cells that don't replace themselves fast enough. And I went, oh my gosh, this is what's happening. Those suckers are growing back, and they don't know how to do it yet, so that every 5th beat, they're skipping a beat. Okay, we got to get it right. Hey, guys, get together. We got to do this right. Then all of a sudden, like 3 days later, right before my knee surgery, everything stopped. No PVCs, haven't had a PVC since. But had he not said, we get these apoptotic cells and then they don't replace themselves fast enough, it never would have crossed my mind. So my body destroys your body. Everybody's body will, not one cell in your body will be the same a year from now. Except your brain and your nerves, they don't die. So even the heart cells, but it couldn't repair them fast enough, probably because I was running too much. But so anyway, I'm really, really grateful for that. That has made a huge shift in my life. Obviously, I'm glad to have had that stress EKG and echo, and now I know that I have 0 chance of a heart attack. Yeah. So I'm going to just keep on running once this knee heals.